Hello, hi, I'm Dr. Monica Singh, a pediatrician and the co founder of MotherYourChild. Today I'll be talking to you about constipation in children. Constipation is a fairly common problem in children, especially in toddlers. In most of the cases, the cause of constipation is functional. That is to say, that the child withholds the stool voluntarily. Now, with that knowledge, let's define constipation. Constipation is nothing but delay or difficulty in defecation or passing stool, which causes significant distress to the patient, in this case, the child. Now, there are two types of constipation, acute and chronic. Acute constipation is the constipation that has been going on for less than 4 weeks. And if the constipation lasts for more than 4 weeks, it is known as chronic constipation. So let us see, why does constipation occur? If there is any change in the diet or routine of the child, if the child is stressed about something, if you've started forceful toilet training for the child before the age of 2 years, or generally due to non-availability of toilet, what happens is the child holds to the stool, which results in the bulking of stools, hence causing large stools and hard stools. Now, when the child wants to defecate, when he goes to the bathroom, what happens is when he tries to pass the stool, since the stool are large and hard, it stretches the anal canal, which causes pain. Now, that impulse registers in the child's mind and he avoids defecation altogether. So now what happens is when the bowel movement comes, the child contracts his external anal sphincter and uses his pelvic muscle to contract the external anal sphincter, which results in successive accumulation of stool. Now, when the stool is in the rectum, the water keeps getting reabsorbed. And when the water is reabsorbed from the stool becomes even more drier. And the cycle keeps repeating. Then the child develops stool holding maneuvers. That is, he refuses to sit in the toilet. Whenever he has a bowel impulse, he'll stand on his toes and contract his gluteal muscles, his back muscles and thigh muscles. He'll contract those muscles. He'll start crying, screaming with pain because he has the impulse, but he's not defecating. His face will turn red, and that will continue till the bowel movement does not go away. How do you treat constipation? The first is dietary interventions. They can be usually done by parents or the primary caregiver of the child. The aim of the dietary management is to soften the child's stool. Now, how do you do it? You increase the fiber content of the child's diet. You include more whole fruits, more vegetables, more salads in the child's diet. You restrict the amount of milk that is being given to the child. You increase the amount of water that is being taken by the child. Make it at least 3 to 4 cups per day with the normal physical activity that the child engages in. Second is toilet training. Toilet training should be started after 2 years of age. For effective toilet training to take place, follow the rule of ones. One person, as in one person, is designated to take the child to potty every time. One place, as in use only one restroom in your house for the potty training purpose. One routine, as in 5 minutes after meal or 10 minutes after meal, it has to be fixed. And one word, use only one word to indicate potty. Use it, either use potty, either use poo, stool, poop, use anything that you're comfortable with and want the child to learn. In a child with constipation, take the child to the restroom at least 2 to 3 times a day, 30 to 40 minutes after meals, and make the child sit there for at least 15 minutes. If the area around the anus from where the child passes stool is inflamed, make sure to treat the area by consulting your doctor or applying a local anesthetic to the area. Also, if the child is using an Indian toilet, it is well and good. If the child uses a Western toilet, make sure to provide a stool where the child can rest his legs, so that a proper angle between the knees and the thighs is achieved. Also, reward the child when the child passes stool, so that the child feels motivated to use the toilet the next time. So if everything fails, we need to seek medical guidance for the medical management. In medical management, we basically have two modalities. One is disimpaction, the second is maintenance therapy. In this impaction, the entire colon is cleaned so that no residual fecal matter remains in the colon. It can be done by enema, rectal suppository. It can also be done orally. The second is maintenance therapy. In maintenance therapy, we basically have two types of laxatives that are used. One is osmotic laxative, the other one is stimulant laxative. Stimulant laxatives are not generally used. They're only used when you are on maintenance osmotic laxatives and you develop constipation in spite of being on osmotic laxatives. We at MYC are utterly grateful to you for taking out the time to watch this video. If you have any questions or suggestions for us, please feel free to ask. Thanks for watching. Happy parenting. Bye-bye.